Okay, we're now quorum. So we have an opportunity now to pummel the panel, but not really pummel them, but to try and eke out of this discussion, I think, really drill down into some of these very interesting debates that the last 2 days have thrown up. We're reflecting back 21 years, which is the equivalent of someone being born and growing up and leaving the household. In maturity, we're looking at a singularly important span of time. I want to start by inviting the panelists in no longer than a minute to give a key point or a key reflection that they can say, you know, is an important takeaway from the discussions they've heard, the presentations they've been listening to. Something new. Don't repeat something that's been zooming around in your head since, you know, the year dot. Try and think of something new that's been triggered by your participation. And we will start totally at random with John Lane in the centre.
I think one good takeaway message that I'm getting is the importance of people's voices being heard as a powerful way of improving equity in services for both water and sanitation.
Okay, very powerful message there. Straight over to Kathy.
For me, what cannot be sustained should not be done. That might be the voice in my own head, but I heard it corroborated. And my own particular punt, I'm tired of the big numbers at that level. The more I interrogate numbers, the more holes I find in them. If we're going to be putting effort into numbers, can we please be looking for the numbers that matter? A friend of mine is collecting tap days. How many days in a month does the water flow from a communal standpoint? Those are the kind of data I'd like to see more.
Fantastic. Eric?
My main question is that we're all concerned, of course, with processes of inclusion of those who are excluded. This is the kind of terminology that we all use and are familiar with. I find this rather difficult, particularly if you consider that the processes of power precisely produce inclusion and exclusion defined as uneven access to environmental goods and environmental bads. Those are included have a higher access to environmental goods and to environmental bads and the other way around, but the two are interconnected. So,
10 seconds.
Exclusion and inclusion are mutually constituted. If you want to include people, we still reproduce the process of exclusion through which they became constructed in the first place. And so we keep our jobs alive too.
Great.
So the question is, what is it the excluded have to be included in?
Okay. We got that. Robert.
Well, this is why I actually disagree with Duncan. Yes, I disagree with you slightly. I think that there is, coming out of the discussions, a lot of scope for innovation with technology. But this is at a very, very local level where we may learn things locally which can then be spread much more widely. And I think this particularly applies to the types of toilets and the surfaces around the hole which qualify or do not qualify for improved sanitation. I think positively deviant local people, probably mainly women, who have developed ways of doing that, need to be learned from, and then we need to share that widely.
Thank you, Robert. Cathy?
What I take away from hearing about Delhi, hearing about Dublin, got me thinking about at the international level, we seem to be thinking about in motorways. Like, we don't seem to be thinking about things in detail. And those motorways can be the wrong motorways. And that is linked to a session's topic called Myths, Models and Realities. So I think we are creating models and myths that do not necessarily represent reality. Whether we talk about performance-based monitoring, or whether we talk about creating a wash sector, or public-private. So that's what I take away.
Okay, very interesting. Who's the we, I would ask? Guri, are you the we?
If I keep my eyes closed, almost 85% what I heard, depending on the scales and others, is same thing I heard 30 years back or 25 years back. So what's new? I mean, really for me, one of the new, not because I'm sitting between these two gentlemen, at least some people stood up and however crudely shouted that here is a tool which can change the world. I didn't hear that in other case studies and models. And my question remains, which is still answered. After 20, 30 years of this development paradigm in the sector, with an inverted comma, the water sector, can this current same paradigm and institutions meet the challenge of the future beyond 2015? I mean, before we think of what the developing countries will do and debate all those facts and figures and the words and jargons, I mean, we should really question that. Can those great institutions, agencies, and which we created during this 20 years, are fit enough to meet the challenge of the new challenge coming beyond 2015?
Good. Duncan.
Okay, I'm afraid it's another engineering perspective. And what I would take away from yesterday and today, particularly today, is obfuscation. I have not heard anything new which would enable me to persuade developing country governments that they should invest in water and sanitation for their urban and rural poor. I've heard a lot of other things which actually do not help me to do that. And I think that is basically a waste of time. You can say you can say the MDGs are rubbish, and I would agree with you. But I would say that we should strive as a global society for universal access to water supply and sanitation, adequate water, adequate sanitation. If we truly understand the meaning of the word universal, then we don't have to have endless painful discussions about gender and equity and this and that. Why should we? We didn't have these discussions in this country as we strove to provide water and sanitation for everybody. What many of you probably don't know, in the mid-Victorian era in this country, the mid-19th century, there was a huge movement against the government providing sanitation for everybody because they thought it was government interference with private matters. At one level that is true,
2 seconds.
but at the other level it is totally wrong, because if not everybody has access to adequate sanitation, then the health of everybody is compromised, potentially.
Thank you, Duncan. Barbara.
I'm going to stick with my change thing on this. I'm left wondering what's going to change in this world to really trigger change in a highly complex world that we live in, to bring about universal access in terms of water and sanitation. I'm just left with that question.
What triggers change?
Well, what's going to change to trigger change?
Change to trigger change. Very good. Undala.
A part answer to Barbara and to the question of implementation that I've been reflecting on for many years. Within the development sector, though Duncan's right in simplifying it quite clearly, the challenge is how do you implement? And a lot of development sector agencies will be trying to do more constantly with less, speeding up rather than slowing down. And I would argue perhaps one of the things we need to do to be more effective is actually to slow down and take the time to build the relationships that are necessary to be able to get the trust, so we learn the interests of the people who today are benefiting from the status quo, so then we have the language to begin to show them why they should care about sanitation, why they should care about water. So if I was to say it in one word, relationships. We need to build, sustain, and keep relationships so we get to the political, to the underlying, to the undercurrent that exists.
Fantastic, a bit like the slow food movement. Slow water. I haven't done that one yet. Okay. Karanka, last but by no means least. But you only have a minute too.
Right. Yeah. What really I'm going to take from these 2 days, very fascinating day. I was telling Robert that, this is where people from both the sectors, water and sanitation, are here. So I could see how the big people from different institutions, represent different institutions, how they position themselves in this water and sanitation. Some work only on water, some on sanitation, some work sanitation for water and sanitation and livelihood, livelihood. I think I'm going back with this conviction again that eventually this, so far as the creating pressure on the state, on the government, equity, all this we are talking about, a lot could be done by these institutions, agencies big. Eventually it has to originate from the bottom and the empowerment of the people. And this has also helped me to understand the debate in the morning, like neoliberalism and all that. What I'm trying to say, CLTS created demand, and many of the national leaders of today have become elected people's representatives, and the moment the success they saw, the state came out, yes, it is my job and everything. The success has got many fathers, and the failure is always an orphan. And I can name Hun Sen, the Prime Minister of Cambodia, in his speech, talking about CLTS, 300 milliliters of ml of shit each Cambodian is producing. I don't know whether he went to liquid instead of a solid, I don't know. And then the Chief Macha of Zambia, Chief Minister of Himachal Pradesh, Moses, Regional Minister of Ghana, these are all champions in the politics, and they all originated with the pressure of the people, created demand, and I think we are in the right track. And we can only help in that.
Very positive view. Thank you very much, Carl. Right, now you've heard some enormously large, wide-ranging ideas. You've heard about equity, power, data, hearing as a tool, obfuscation as the antithesis in the sense of good hearing. We've heard about change, you hear about demand, you've heard about the CLTS success stories. Now, audience, this is your chance to try and drill down into some of these questions and see what we can glean from discussions here about the way forward. So the next 5 years, the next 10 years. It's a common trick in development to say we've got to do lesson learning, more communication, more integration, and everything will be fine. Is that the case here? What do we need to do? So I'm opening the discussion up to you now, and the panelists are going to be part of this discussion. It's not going to be a two-way process, hopefully a more pluralistic discussion. Yeah.
My name is Naha Veeramanchi from the London School of Economics and Political Science.
And then the country we come from, also, please.
I'm originally from Japan, but I reside in the UK. One thing that I'd like to know is where does water and sanitation stand in the bigger picture of things? For example, what are the cross-sectoral implications? What does water supply and sanitation have to do with agricultural water, urban planning? How can we start talking about these cross-sectoral linkages, as it were?
So let's try and stick to that theme. Anyone else in the audience wants to interrogate that theme? I'm sure that you can bring some examples from South Africa, Sinna, or more generally.
No, it's more of a general comment just to follow up on that theme, because I was struck by the mentioning of equity that Barbara was mentioning, and also was what Duncan was emphasising in terms of universal access, and equity is at kind of the heart of this. And last year there was a book came out called The Spirit Level, which talked about how equal societies do much better in terms of everybody's well-being than unequal societies. And interestingly, it was not written by two economists, but two epidemiologists. So I'm thinking, how can we link up, the water sanitation issues to more societal progress and development, and in terms of how do you ensure that equal access to services is made, is represented as a case of making a more equal society, and it's a good society. So how can we link it up into the broader subject or into the broader discussions about what societies we want to have?
Anyone else in the audience on that particular point? No, it has to be on that point because I'm going to turn this over to the audience, to the panel, almost equal in size. Robert has his hand up.
I think one linkage was made, I think Barbara made it, which is a really, really powerful one, and that is that poor sanitation and hygiene is responsible, according to WHO, for 50% of the malnutrition of children. I mean, that is, if that can be substantiated, which I think is very likely and well substantiated, that is a very, very dramatic finding with huge implications which could be used in advocacy.
Can I mean, this has to go to Barbara, and to John. Where's John? Here. Because WarTrade has been, can I use the phrase, banging on about this for so many decades. What's the problem?
Well, that's kind of what I'm asking too. I was very taken by that book, The Spirit Level, because I thought that was really extremely interesting. And I was really surprised that it didn't get picked up actually in the international development discussion, because it was very much, it was quite popular with the incoming Conservative government when they were in opposition, talking about inequity being an issue in terms of antisocial behaviour, teenage pregnancy, mental illness, etc. When they came into power, they distanced themselves from the writer of the book and the thesis. But I thought that thesis was so interesting because it was exactly showing this direct correlation with issues of equity and income and well-being, basically.
Yeah, just to add a brief point on that, if I may. We're just doing planning now for the strategy for the 5-year drive on sustainable sanitation. And the two major themes that we're looking at, one is that improved sanitation contributes to economic growth. So we're addressing that to ministers of finance, to the media, to people in positions of political power. And the second one is that improved sanitation increases human dignity. And we see that the dignity aspect and the economic benefit aspect are powerful arguments that we can use that resonate in the language of our audiences. Because for years, you said, why have we been banging on about this for years and not making enough progress? I think it's because previously we were talking to ministers of finance or of health or whatever using water and sanitation terminology, saying it's important to us. What we're learning now is that we need to say that this is a subject which is important to them in their terms and to achieve their aims. And I think that's a real breakthrough.
As the Collaborative Council, you don't collaborate enough. Outside of your nearest and dearest.
Outside of the sector, that's right. We need to do more outside our own sector.
Go.
Richard, you tell me whether I'm wrong or not. But again, I'm saying that this is our story, because one of the earliest studies has been done by Steve Estre, who is no more, with the Sandy Camp Cross in Movila Plateau in Mozambique. That was only empirical study done. It is very easy. We all say, and we know, so we give the message that yes, it has directly connections with the diarrheal disease or malnutrition. When you come to actually a planner, when you come to an economist, when you come to a person who allocates money, that person will listen to a doctor, because if you give one immunization shot, you can say that I have saved the life of the child for that particular disease. And this is the greatest problem. We talk emotionally, but empirically there is not sufficient data to directly correlate of investment and the return. In fact, I couldn't get a single data that where you can say that by not doing sanitation, the state or country is losing that much of income out of the tourism. There is no data. So
out of date, we're getting a lot now.
It is there. I know it is there, but it is not empirically true, because it has to challenge the Johns Hopkins. Johns Hopkins was always opposed, because when you take a planner decision of putting $1 for saving a life, I will rather go and put in immunization than on vague water sanitation where there are 20 variables and you have to change your behavioral pattern. John, this is the thing. I mean, you have to understand the other side of the table.
Linkage. Very hot topic, clearly. Anyone else wants to interrogate linkage or to respond? Well, I just want to provoke a little bit. Is the epidemiological data good enough to be widely used as evidence?
The answer to that question is yes. We know that, in response to that question, we know that repeated episodes of diarrhea in infancy are associated, probably causally, but certainly statistically, with poor school performance in later childhood at the age of 8, 9, 10, and with cognitive impairment, and with lower adult productivity. Exactly the things you don't want if you're interested in socioeconomic development. And there's a huge amount of work on that. It's not only just diarrheal disease agents, it's also the intestinal helminths also cause that cognitive impairment and lower IQ. And there's a huge amount of work done on that. We know that. And if that's news to you, then actually you shouldn't be here unless you're a student wanting to learn. The discussion we've had yesterday and today has, in a sense, been predicated on everybody knowing the benefits of water and sanitation. And yet I don't believe that politicians, decision makers in developing countries, understand the benefits of improved water and sanitation. And we need to inform them of that. We need to tell them that if you don't invest in water and sanitation, you will get this much, you're already suffering this much excess morbidity and mortality, lack of cognitive development, impaired adult productivity. And is that really what you want? And if they say yes, that's what we really want, you say okay, goodbye. And if they say, oh no, we didn't realise that, then you say, okay, we can help you. We can train we can educate your politicians, we can educate people in the Ministry of Health, Ministry of Water, and so on, so that they understand this. There's a really important linkage between water, sanitation, and health, with health being defined in the WHO way, not just as the absence of disease, but with social well-being.
Duncan, when did you last talk to a politician? What did you say?
I've said many things to many politicians, and last year, for example, and they all say, oh yes, but they don't do anything. It doesn't matter whether you're talking to British politicians, English politicians, African politicians, Kenyan politicians, we all know what politicians are like. You can ask a politician a question, and they will not give you the answer to that. They will reply, but they will not give you the answer to that question. That's true. And that's a huge problem with politicians. And it's not for them not being asked the right questions.
And partly the problem is that we're not very good at being lobbyists. Now, there are a couple of questions around here, but I want to make sure the audience is fully integrated in this discussion, and I want to hear from people who haven't spoken already in plenary a great deal. And then I'll go back to the panel. Now, is it on the linkage issue? Yes, no? Ish, no, not good enough. Has to go back to the panel.
I just wanted to say, listening to you and your debates, to me it sounds like the water sector saying, we have data, we are great, please listen to us. You also need to listen as Ministry of Finance, Ministry of Health, Ministry of so and so and so and so. So that is a one-way integration. How does the water sector actually need to listen to the health sector, the education sector, the finance sector, and so on? I mean, it seems to me like, listen to us, but what do we?
On linkage. Kathy? Yes?
Yes. Can I just just pick up on that last one. I recently came across an obscure medical journal article which was arguing that open defecation spreads helminth eggs, and helminth eggs hatch into real live worms that undermine the efficacy of ARVs. Now that's quite serious. I mean, to me that's a whole new angle. Antiretroviral effectiveness can be inhibited by worm infestation. Now, there's vast amounts of money going into HIV treatment. Is this not something that we should be exploring further? I'll happily send out the reference.
I want to very quickly, because we don't want to bang on about linkage.
In many ways, I haven't read the book that you mentioned, and I'm surprised that it is proving so dramatic, because we know inequity is the problem. Hence, in 1946, the British government set up the welfare state. We are seeing rising privatisation, rising inequity. We know that. So I'm surprised. And if it's about marketing and being able to find new ways to say the same thing so that people become interested and want to change, well and good. But we also know, I mean, the United Nations Development Programme was set up precisely to increase capacity because it was, oh, people don't know. If people knew, they would act. And that's a fallacy. How many people here smoke? How many people here know that smoking is bad for you and yet do it? Because there are benefits, there are personal benefits to doing it. So knowledge is not the same as action. And that goes back to the point that Barbara was making earlier on. Why doesn't change happen? So that's, at some level, I mean, this is very complex. Now, for your point about water, cross-sectional, I mean, that's a whole discussion. One of the challenges for the water sector is that it is not a sector, because it impacts every single aspect of life. There is nothing in this room that exists today without water at some point in its process. So water can go everywhere, it does go everywhere. So the challenge, if you're talking about, water sanitation and agriculture, in many communities, if you have access to irrigation, that's your drinking water. And actually that's your washing water, and that's where you defecate. So it's intimately linked, and it would be very broad to go further.
Okay, we have one last point. Richard, I'm sorry you missed the bus on this one, but in the next round. Yeah.
Just to say on linkages, and also bringing up the question of equity, that we've had very interesting discussions with people working with disability and development, on gender and development, on HIV, the HIV/AIDS Alliance, because there is and they all say, well, come and tell us about WASH. We know about the issues about being, our kind of areas of what the barriers in accessing services, but we don't know about water and sanitation solutions, and there's a huge issue of silos and potential for working together with other groups of activists and groups of whole sectors that are not necessarily health and education, but they're also interacting with health and education because they're also preoccupied with how to get better access.
Thank you. Now Carlos has a linkage.
Yes. So my question was actually about linkages. It was actually about how we conceptualize the linkages that we've done in terms of water, how we conceptualize the linkages of policies with policy making and power. What for me is what I will get from this conference is that we're analysing bits of reality that are all interlinked, and we should think of the name of this conference of liquid dynamics as something that is interconnected. How would you analyse, and this is where the discussion about knowledge comes, is how would you analyse, for example, the functioning of the stomach? The stomach is part of the body, and engineers, doctors, lawyers, whoever actually can give explanatory power on how that certain part of the body functions is relevant. What I think that for us is important is not to lose the holistic view of how water is operating in power dynamics. And for me, that's really worrying because it has implications in terms of practice. If we don't put power in the centre of how we look at water dynamics and how policymaking is done, we are in serious trouble of partialising knowledge and partialising solutions. So this is all I wanted to say, because it's about including what's excluded, including the excluded in all levels of power conversations. This is already very political, and if we exclude certain issues from the agenda on how we look at power and how water is run, we are not linking things.
No, very interesting. How can we blithely talk about linkage without confronting power?